for prevention of pregnancy, the percentage of effectiveness hits the roof. It's like 100%. You know, we can't say it's 100%, but then it's like 99.9999% if combined with your safe period. Hello, today we will be talking about this. Postpill. Postpill is an emergency contraceptive pill, meaning that it is a pill taken to prevent pregnancy, right? Not to terminate pregnancy, but to prevent pregnancy, and it is used for emergency situations. Don't worry, we will list some of those emergency situations. Now, I've done several videos on emergency contraception and emergency contraceptive pills. So why am I doing this? Don't worry again, this is because this is more effective and safer to use. I will also give you the reasons, so just stick with me to the end of this video and go ahead to hit the like button, because definitely you're going to like this video because it makes things easier, safer and more effective for you. So previously I've done things on emergency contraception and different emergency contraceptive pills, but the problem is these pills contain more than one tablet, and because of that ladies forget. They forget to take maybe the second pill or the other ones, and because of that it affects the effectiveness, right? And some persons get pregnant, right? And that is not what we want here. So we needed something that is easier. The beauty here is that Postpill just contains only one pill, so just one pill, right? So there's no forgetting here. And apart from that, the other pills I've mentioned are restricted, strongly restricted to being taken within 72 hours. So like 3 days, 72 hours of sexual intercourse. However, the beauty here is that this even extends to the 5th day, right? So even if you forget or you are not able to get these within the next 3 days, if you can get it within next 5 days, you can still take it, right? Even though we know the earlier the better. It's a principle for emergency contraception, the earlier the better. But all previous ones I've mentioned on this channel are strongly restricted to 72 hours. However, these can extend slightly above 72 hours into the 5th day. And so it gives a lot of room for safety, for prevention of pregnancy, for ease of use, and for effectiveness. And it's important to state that you take these after sex, not before sex, meaning that after taking this, if you still have sexual intercourse, you have to take it again. I don't know if it's clear, because if you take this and have sexual intercourse, there is no guarantee that it will prevent or protect you for the subsequent sexual intercourse. So you had sex, you took this, and then you had sex again, you have to take it again. Even though we discourage this arrangement because we want to reduce the number of times you take this in a month. You can imagine how it will mess up your menstrual cycle. So if you know that you will be requiring some form of contraception several times in a month, then you should go for other contraceptive methods. In fact, the best is you take it once in a month, right? But we know we give allowance for people that want to take it for more than once in a month, but let it not be more than 4 times in a month, because you know it will mess up your cycle, and apart from that, the side effects will be more and prolonged. So quickly, let me recap 2 things here. Unlike other contraceptive pills that require, say, 2 pills, this requires 1. So instead of taking 1 now and taking the other tablet 12 hours after the first tablet, and then some ladies forget they take before 12 hours or after 12 hours, you just take this once and you are done. Apart from that, while others are restricted within 3 days, 72 hours of sexual intercourse, this can extend a little beyond 72 hours into the 5th day, even though we say the earlier the better. And by the way, if you're finding this video very helpful, do well to hit the like button right now, and I would deeply appreciate, yes, hit the like button now, yes, thank you. So how does this work? It works in 2 ways. First is it prevents ovulation, because pregnancy happens when the sperm cells meet with the ovum cells and they fuse. However, this first prevents the release of the egg, the release of the ovum. That's number one. Number two, it prevents the movement. It affects the movement of the sperm cell and prevents it from reaching the ovum if at all it has been released. I don't know if you understand. It prevents the sperm cells from getting to the ovum, and it prevents the ovum or the egg from being released. So this way it prevents pregnancy up to, now listen, if used correctly, pregnancy rate can be as low as 0.8%, not even 1. So if 100% take it, only less than 1% will get pregnant if taken correctly. So this is powerful. This is very, very effective. Now, this is when it is taken within 72 hours, within 3 days. So 3 days after the sexual intercourse. So the effectiveness slightly reduced when you stay beyond 72 hours, but then it is still about only 1.8% of ladies will get pregnant. So it's not even up to 2 ladies even after 72 hours. So you see how effective this. Now, granted, this is on the upper limit. There are lower limits to these, and then the little averages here and there. But then this is how powerful, how effective this can be. So when do you take this pill? What are the situations when you take this? You take this when you want to prevent pregnancy, obviously. And this is not for abortion. This is not for termination of pregnancy. No. And you take this when you don't want to get pregnant in situations like rape or forced sex, especially when it is unprotected. Also in condom problems. So you did not wear the condom properly, the condom tears during sexual intercourse, or there's spillage, especially when you are trying to remove it, there's a spillage. It is good to take emergency contraception. Also in situations where you are not sure about if you are in your safe period, what I usually tell my client is, even if you are sure you are on your safe period, you take this, the percentage of effectiveness hits the roof. It's like 100%. We can't say it's 100%, but then it's like 99.9999% if combined with your safe period, right? 99.999%, right? Those are the situations where you use it. They have condom problems. Maybe the condom was not worn properly, or it tore during sexual intercourse, or there's spillage, or when it was a rape case or a forced sex case, or when you're not sure of your safety if you're in your safe period, or sometimes in crazy situation where your partner deliberately refuses to wear condom, and so you just take this on your own. Also in situations where the guy didn't pull out correctly or in time, right? Withdrawal method, coitus interruptus, and I've done a video on this channel on how to have effective withdrawal method to prevent pregnancy when he didn't pull out early or correctly, when he didn't withdraw early or correctly, and so some semen actually got in. So this will be the right time to also use post-pill or emergency contraception. So apart from the fact that it is just one tablet and it will help with compliance and you not forgetting, and also the fact that you can extend it even up to 5 days, unlike other ones we've discussed, it is very, very cheap. In fact, I got this for about 350 naira. That's about $0.92, not even up to $1, right? So I got this for less than $1. It is that cheap. So what about side effects? Now, another reason why I love this particular product is that the side effects are very minimal. They're minimal compared to others, and secondly, they go away quickly, right? So they are minimal and they go away quickly. Very interesting aspect is that not everyone experiences this side effect. No. So they include things like nausea, headache, menstrual changes, right? So your menses may come before or come a little later. It may have increase in the volume or the flow, or reduced volume, but generally the symptoms are mild, they go away quickly, and not everybody experiences these symptoms. This does not cause infertility, because I know some persons jump up and to say, hey, this is the cause of infertility, then you took a lot of Postpill and Postinor, and that is why you're finding it difficult to take in. The effect doesn't usually last beyond few weeks. So infertility is not one of the side effects of these drugs. And most importantly, I have to state this because several persons contact me concerning this. After taking this pill, they discovered that their period delays few days. Please don't get worried about this. If you are worried, do a pregnancy test and then after a few days repeat the pregnancy test. But sincerely, it could just be the side effect of the drug where it delays the period a little more than expected, and then there shouldn't be any cause for alarm, especially if you took it correctly, meaning that you took it immediately after sexual intercourse and best within 72 hours or at least within 5 days. So can breastfeeding mothers take this? Yes, even though we know that breastfeeding in some women and for some period for some women in itself can prevent pregnancy, but if you're not sure about that, you can take emergency contraception if your baby is more than 6 weeks. So if you find this video very helpful, do well to hit the like button and stay subscribed to this YouTube channel, and check the description section below for videos related to emergency contraception. Take charge of your health and happiness, and I'll see you in the next one.